Hi, my name is Jenny Tollison, and I am interested in researching effective approaches that school counselors use with students who deal with anxiety, whether formally diagnosed or not. According to some sources, there are approximately 4.4 million children and adolescents in the United States who had problems with anxiety. This was in 2016. And then additionally, 10 to 20% of children experience such high levels of fear or worry that if assessed, they would meet the criteria for an anxiety disorder, yet they did not get treatment. Students who experience clinical anxiety or undiagnosed anxiety symptoms are at risk for poor academic outcomes, personal social problems, and harmful effects on career development. School counselors are charged with impacting students in all three of these domains, thus they are in an ideal position to help this underserved population of students. And as a person who has dealt with an immobilizing anxiety at times, I have a personal as well as professional interest in helping students who suffer from anxiety. My research position is that I am a white, heterosexual, middle-class female. I am a school counselor. I am a wife. I am a mother. One major bias that I have is that I think that mental health issues are not always permanent. While I believe that mental health diagnoses are real, I also think that people can learn effective coping strategies and that their brains can change. Oftentimes, the environment must change as well before coping strategies can be effective. These beliefs may influence my research topic because I may see anxiety as a problem to be solved versus a medical condition to be treated. My position may be perceived by others as a place of privilege and cause me to be seen as unrelatable. In terms of Peshkin's subjective eyes, I can find something in each of them that resonates within me. But two stand out to me, so I'm going to share those. Number one, the non-research human eye. Kindness. Kindness is a subjectivity for me, so when people demonstrate kind behaviors, I soften and get that feeling like I want to make a way for the outcome to turn out in their favor. Research is geared at uncovering the truth, so it is in everyone's interest to report and share all facts. This is difficult for me in the face of kindness. The second subjectivity eye, or subjective eye, is the e pluribus unum. I love diversity and acceptance of people. I may have a tendency to overlook other problems when people show kindness across racial and ethical boundaries. When gay people are not talked about in a strange or negative light, when poor and wealthy mingle, when overweight or unfashionably dressed feel just like everybody else. If all of these factors were present in one place, I'd probably have a hard time seeing that they have a problem. But hopefully not. But it could definitely shape my perspective if I'm not intentional to disallow it. For my research topic, I chose to interview other school counselors to identify practices that they use to help students with anxiety. Because of my position of privilege and as a doctoral student, I may be viewed as the authority on the subject that I'm questioning interviewees about, thus possibly affecting how they choose to answer questions. I think that the main adjustment I would need to make to ease the minds of the school counselors who participate in my study is to explain that I'm compiling information from compiling information from other mental health professionals to see where the strengths and needs are, not just the needs, but the strengths as well. I want to know what they are doing that they believe is working, as well as what they're needing support dealing with. As a scholar in training, I believe that my subjectivities are impacting how I complete assignments, even in this course. For example, I have never really put a whole lot of effort into discussion boards because they always seem like busy work or check-ins rather than purposeful or meaningful assignments for helping us with future assignments. So I'm learning the hard way in this class especially that each assignment has a strong purpose, and I think I will be a better student as a result. I have also had the subjectivity that online teachers do not want to interact with students, so I haven't reached out as much in the last few years during my master's degree at Liberty University, during my specialists at UWG, and now. And I now realize that this has kept me from maximizing my learning during my courses. It is, this occurred to me with something that Dr. Pope said about keeping the dialogue going with other students and her about or during the unrequired discussions. So it was when she said that I thought, oh, she wants to respond. And so with that thought, that feeling that happened that I later thought about was me becoming aware of my subjectivity. And so I thought that, well, I need to trust that when they say we want to help, that's what they actually mean. So I think I'll begin interacting more and see where that leads my research and learning. I think the most important way to remain aware of my subjectivities is to pause when I get that gut feeling and think about what just happened. What am I avoiding, or what am I wanting to avoid? Continuing to talk about this will keep it fresh in my mind. Thanks, guys.